Dear American Theater, on June 3rd at an online theater conference, a prompt was given to the tune of, what can we learn from COVID-19 to reopen our theaters with an attention and focus to dismantling white supremacy and anti-Blackness? The breakout room I was in was a microcosm of our industry, with 6 white men, 1 black woman, and me, a queer Asian American cisgender male with an invisible disability standing on the unceded land of the Ohlone people. I won't get into the details of how the room's power dynamics unfolded, but rather how the dynamic led me to an answer. But first, I want to acknowledge we are still in a time of great civil unrest. Black lives matter and will continue to matter until police brutality stops and white supremacy is extracted out of our nation's culture. So what can COVID-19 teach us about our theater industry, centering the dismantling of white supremacy and anti-Blackness, as well as uplifting the Black and Indigenous folks and other POC voices? White supremacy is a virus, and anti-Blackness is a symptom. Racism, white exceptionalism, unconscious bias, fragility, toxic masculinity, assimilation, and so many more manifestations of oppression are all symptoms of this disease. And we are all infected. White, black, Asian, cis, trans, hetero, queer, disabled, rich, poor. A virus does not discriminate. I'm sorry. If you grew up in a westernized society, if you consumed Western media, were educated in a westernized school, engaged in a westernized social gathering, walked down a westernized street, then you have been exposed to white supremacy, and you have touched your face, your eyes, your mouth, and you are infected. Now, this disease doesn't affect everyone the same. Black and Indigenous folks have a massively compromised immune system because their thymus gland has been working overtime since they were born, fighting the infection internally and externally on a daily basis. The harmful effects of these symptoms? Pain, shortness of breath, fever, delusion, nausea, vomiting, insomnia, depression, anxiety, a sore throat from screaming and crying, mental and emotional trauma, difficulty walking, difficulty breathing, difficulty living, death. Now, am I talking about COVID-19 or am I talking about white supremacy? White folks and people of color, if you are not displaying those harmful effects, it does not mean you're not infected. It just means you're asymptomatic. And you might be carrying a more deadly strain because you've allowed that virus to grow and mutate in your body. Without taking the safety precautions of washing your hands regularly with a privilege check, wearing the mask of education, taking anti-racist social distancing precautions, applying the antibacterial gel of transformative justice, you have unknowingly spread a dangerous strain. Coughing microaggressions, sneezing macroaggressions, shaking gaslighting hands, leaving droplets of triggered traumas, recycling the air of racism. I have been taking those safety precautions. Some of us have been taking those safety precautions. And unless you are doing those things as well, I can't safely be in a room with you. And I can't assume you're taking those necessary precautions because some of you just got your test results. So you need to prove to me that you will prioritize our safety before I meet with you, before I begin an artistic collaboration with you. How does that affect the theater? Well, our buildings are infected, our theaters are infected, our classrooms, our textbooks, our rehearsal halls, our audiences, our artists are all infected. There's an outbreak of white supremacy and the state of theater is infected. And we are all looking to reopen. So as we look to reopen, let us take the steps to prepare our spaces to fight COVID-19 and white supremacy. But first, let's talk about getting an accurate diagnosis. Right now, I'm just playing the role of journalist. I'm looking at the data, consulting with the scientists, and I'm reporting this virus exists and we're all infected. But what strain do you have? What are your symptoms? How do you diagnose your white supremacy? Don't just turn to someone else who's infected and ask. And don't turn to the sickest and weakest and ask just because the vulnerability to their virus is apparent and the effects of it are hitting them the hardest does not make them an infectious disease expert. Don't just go to your Black friend. Perhaps you think you have a mild strand and you can educate yourself with books written by medical professionals like White Fragility, which is a whole nother story for another time, but anyways. Or check out the resources of a medical lab such as Art Equity, consult WebMD or Huffington Post, Teen Vogue. But be cautious. Like WebMD, you can accidentally misinterpret your symptoms. Approach all these things with the same critical thought you give diagnosing a personal illness. What are the credentials of those you are researching? If you have the time and capacity and funds, consult an expert that you should be compensating. See a qualified nurse who has been practicing social justice work. Visit a doctor who is steeped in EDI education and has an established practice. Yes, they're also infected, but they're knowledgeable enough how to diagnose your illness while keeping their symptoms at bay, taking precautions to avoid spreading the disease. They can work with you to create a plan to minimize the spread of your infection. And for those of you who are experiencing painful symptoms, they can offer treatment on your path to recovery. To be clear, I'm not saying you should dismiss the experiences of those who have been affected by the virus the most. Survivors of white supremacy are experts of their experience, not on diagnosis and treatment. Speaking of seeking treatment, be cautious of taking the meds prescribed to someone else. They're probably helpful, but everyone should be working with their medical team to ensure the right meds and right doses are being prescribed specifically for your case. You may not be ready for surgery. You may not be ready to discuss how your innocent question of, but do they actually live there, is steeped in white supremacy and anti-blackness, because Black people have to disproportionately prove their belonging to a place more than white folks. You may still need to take your white privilege as real pills. Recognize some over-the-counter drugs may just suppress the symptoms, but not battle the virus. The Black Lives Matter statement is a cough syrup. The safety pin is there to reduce your fever, but the infection is still there and you may still be spreading it. Be wary of the nurse in training, those who think they're ready to draw your blood, but are only trained to take your temperature. They can try to help, but they might cause harm. Be leery of the WebMD expert or the snake oil dealer, all potentially good resources of information, but still you need experts from different schools of thought to properly treat what ails you. But just like most illnesses, we know that there are some good general treatments and habits that will benefit everyone. Exercise, vitamins, sleep, unconscious bias training, anti-racist education, decoded videos. And there are strong support groups for those in recovery. Seek those that are led out by a trained facilitator. Now, perhaps you have a good friend who is a doctor or a nurse. Take them out for a meal, or due to COVID-19, for an at-home delivery, and get a free consultation and listen. And if you trust this person enough to seek their advice, don't tell them that they're misdiagnosing you. Okay, so we have this pandemic, COVID-19, white supremacy. How do we deal with it in a way so we can gather again safely? While I'm here, let me lend you some of my expertise. What does spread prevention and treatment look like? Equity, diversity, inclusion, justice? What does this look like in the theater? Is diversity a cure? For our industry, a lack of representation is a symptom. Diversity is hydration. It's necessary, but doesn't get to the core of the illness. Sticking the bodies of people of color into theaters, offices, rehearsal halls, stages, classrooms that are infected without proper cleaning, and with artists and audiences that are infected and not practicing safe precautions, that exposes those who are the most vulnerable to more dangerous strands. It's like hydrating or cleaning with infected water. It compounds the sickness. Your boardrooms, your faculty, your artists, your audiences who may be asymptomatic to the harmful effects should not be inviting the most vulnerable into your space unless the asymptomatic know that they have to use proper safety precautions. Regular hand washing, social distancing, disinfecting surfaces, wearing personal protective equipment. It's the unconscious bias training, the community guidelines, the anti-racist work. That's how you make vulnerable people feel included. You let them know that you're aware of the disease and you're aware of those who are infected, and you are doing everything you can to reduce the risk of additional exposure and harm upon contact. That's inclusion. Welcoming vulnerable populations shouldn't seem like a burden. It should be the default safety for everyone. What about equity? Equity is an acknowledgement of our reality that the most vulnerable actually need more support. It is an acknowledgement that not everyone is inclusive. Not everyone believes in science. There are deniers of COVID-19. There are deniers of the death rate. There are people not wearing their masks, and there are people who want to open up too soon when there is not enough education on the dangers of this virus to the most vulnerable. Not everyone is taking precautionary steps to reduce risk to others. This acknowledgement of equity also means knowing asymptomatic people have more time, energy, and access. They have the ability to expose themselves to untreated disease-ridden areas without further harm to themselves, and they get to reap the benefits of accessing those areas. Through herd immunity, they can go to the beach, they can go to the pool party, to an in-person class, to get their nails done, their hair cut, to sporting events, enjoying the pleasures and privileges of rest, relaxation, education, and social interaction without harmful effects. They get a slight fever, but they don't need a ventilator. Equity means if you have the privilege of a strong immune system, you're spending your time and energy to do grocery shopping for the immunocompromised. You're educating other people on social distancing and safety precautions. You're utilizing your privilege of health and immunity and the benefits that it grants you to distribute access and needs to the vulnerable. True equity is recognizing this imbalance and using your privilege to correct it, knowing your exposure to more harm pales in comparison to those at higher risk. Theater leadership. You are the governors deciding how to manage and open up your state, dividing the resources of your theaters equitably to serve your entire community. When you provide commission to writers of color, hire artists of color, make performances accessible to those who are in need, please do the labor to hold other healthy folks accountable for possibly exposing a vulnerable group to a more dangerous strand of the disease. Know that other spaces aren't inviting them in because it's too much work. Know when a vulnerable person walks into your space, even if you have cleaned your space, they have walked in from a world that has not. So they will need more resources, more support, more mentorship, more guidance, and because you've reaped the benefits of a healthy immune system, you should provide those things. But don't disingenuously ask. Offer meaningful support and change, and stand with those who have been marginalized. Do not force your recovery plan. Discover what their needs are and provide. Some of us have been seeing our doctors and we know when we need additional support, but historically, you've been washing your hands for 5 seconds, and when we asked for 20, we got pushed back. So let us know when you're ready to sing happy birthday twice. In fact, go further. Some of us may not yet have been diagnosed. Some of us have been misdiagnosed. So you, as the governors of the field, must recognize when someone is sicker than they appear and put safety measures of support into place, using the benefits you've reaped from your privilege. So how about a vaccine? Justice is the scientific research leading us down the path to a vaccine, and we're on a long road. Destroying this disease by dismantling the systems that make the weak weaker, the strong stronger, stepping above prevention and healing, and moving toward the eradication of the disease entirely? Will the American theater invest in the vaccine to white supremacy? Will it invest in justice? Not as quickly as the world will find the vaccine to COVID-19. The vaccine for white supremacy will take a lifetime because, remember, there are anti-vaxxers out there, and they're in our industry. Everyone, let's educate ourselves on the value of science and our medical professionals. Take the same time and resources we spend on trying to reopen through COVID-19 and invest in the eradication of white supremacy and anti-Blackness, so we eventually can safely gather together, all together in the theater. Not everyone is affected by this pandemic in the same way, and not everyone is affected by white supremacy in the same way. But fighting them both will require collective thought, action, and work. So, let's get to it.